Hi, I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today I want to talk to you about the use of the OsteoGen bone graft material and proper sequencing of placing implants along with the bone grafting and our hemostipe safe gauze dressing. So what I normally do is when I take out teeth, whether it's a couple teeth or a whole set of teeth, I usually place the implants at the same visit. Now, a lot of you may prefer to place a bone graft and wait a few months, and that's perfectly fine. But I like to place the implants into the available bone when I can visualize it at the time of extractions. So I'll take out the teeth, I'll clean up all the granulation tissue, curette it all out really well, trim away any excess tissue that's inflamed, and I will find a purchase point for my pilot drill. Usually, if it's in the upper jaw, that might be toward the palate or the mesial or distal. In the lower jaw, it's typically mesially or distally into the proximal bone. Sometimes we go right on the crest of the proximal bone, right on the crest. Or sometimes it's in the furcation area, in the molar area. But we find the available bone to place our pilot hole. We then screw our implant into place. And then what we do once we have the implant in place, and keep in mind, the depth of the implant, because now you don't have any soft tissue. So what we want to do is bury that implant so the top of the threads are equal to the top of the highest point of the bony crest, the bony ridge. So the thread should be at the top of the thread should be at the top of the bone, and then you allow the tissue to heal, and that'll cover up the polished collar. So once you place that implant into place, okay, then you're going to take our OsteoGen bone graft, either the slim or the large, depending on the size of the defect, and pack it into the bony space, the holes in the roots, where the roots were. So you're going to pack that bone all the way into those sockets, okay? Once you fill the sockets with the bone, then we take our hemostipe safe gauze and we pack that over the top. Now that is a resorbable gauze material, and it helps to hold the bone in and form a clot over the top. And then we just suture things up if we can, and if we don't have any tissue to suture, then we just leave it with a gauze over it. It'll form a clot. The tissue will heal in a matter of days. And over the next several weeks, that bone will start to form into normal bone, and over many months, it will actually turn into solid bone. Now, you can use it with or without PRP, with or without PRF, that's up to you. I normally do it with just the bone and the safe gauze. A lot of you like to mix it with the PRF and the PRP, and that's great. If you want to do that, that's fantastic. So that's how we use the OsteoGen bone along with the safe gauze. It works really, really well, and you're going to have great, great results with it. We call it the OsteoGen with the hemostipe gauze dressing, and it will work great, and you'll look back 3-4 months later at the x-ray and you'll have great bone fill. And initially what it'll do is it'll keep the architecture of that bone and that tissue so that you can build your temporary on there. And then ultimately after about 4 or 5 weeks, you'll take the temporary off, take your impression, and make the permanent crowns or bridge or roundhouse, whatever the case might be. And it'll all be done in a matter of 5 or 6 weeks. You'll be all done. So that's what I do with the OsteoGen. And again, it comes in a slim, a large. It also comes with a sheet. So if you want to build up a ridge, you can put it over the top or a bony defect as a sheet. So thank you very much for being here with us on this Monday Morning Minute, and we'll see you next time.
Good morning, I'm Fitz. I just wanted to follow up with what Dr. Shatkin was saying. The OsteoGen, either the plugs or the strips, what a great way to bone graft. And if you're using the LPRF Intraspin, the very best. We're having a special this week. If you buy 4 boxes of either the strips or the plugs in either size, we'll give you 1 box free. So you'll get a total of 5 boxes for the price of 4. We have a lot of specials going on at Shatkin First this week. Blockout shims, impression copings, healing caps, you name it. So call and ask for Nick or Kevin, and they'll get you set straight. Also wanted to tell you how nice the hemostipe works with the OsteoGen. The hemostipe is a reabsorbable membrane that Dr. Shatkin likes to put over the ridge to aid in the healing of the extracted site. So When you're talking to the guys at Checkin' First, ask them about the hemostape. It's a great tool to have in your tool chest. And if you haven't purchased the IntraSpin yet, think about doing LPRF at your office. It's such a great thing to do for the patients. I also would like to talk about our course coming up this week on Thursday and Friday, the 15th and 16th of April. We still have some seats open, so if you want to come out, please give us a call. Come on out. Dr. Shakin will be lecturing. Dr. Gillespie will be lecturing. Dr. Shakin's going to be talking about the successes he's had with the mono implant, the myelo implant, and the MDLs. Also, he's going to be doing live surgery on Friday. So this course should be absolutely awesome. If you haven't signed up yet and you want to come out, we do have some seats left for the course. We are keeping it socially distant. We're not having a full house. We're scaling it down a little bit in respect to the COVID that's going on now. So if you're interested in coming out, please give us a call at 1-888-4SHACKIN. We'd love to see you on the 15th and 16th of April. And I'd also like to talk about our World Symposium this June 3rd and 4th. Dr. Shakin and lecturers from the International Academy of Mini Dental Implants will be lecturing on the benefits of mini dental implants and minimally invasive procedures. We'll be talking about the MDL, the myelo, and the mono implants. Dr. Shakin's going to be doing live surgery on Friday. On Saturday, and it's your prerogative if you'd like to stay for Saturday, Dr. Samuel Shakin will be giving a course on Botox and fillers. And that's going to go from 8 a.m. on Saturday morning to 3 p.m. in the afternoon. All dentists are welcome. You can see all the information on our website at checkinfirst.com. For more information, you can call Kevin, Nick, myself. We'll get you all squared away, and we'd love to see you out here in June. Then we're jumping right into August. We always go down to Disney World in August, and this year, we missed it last year due to COVID, but this year, it should be a real fun time down there. We're going to be taking all the COVID regulations into account, but on the 6th and 7th, we'll be at the Beach and Yacht Club, and we'll be lecturing with a great host of lecturers. We'll also be talking about the benefits of mini implants, and we'd love to see you down there with us. Then, we're going to be doing the International Academy of Mini Dental Implants. Now, it's going to be a little early this year. It's not going to be in October. It's going to be September 24th and 25th, and it's going to be in Nashville, Tennessee. So put it on your schedule, September 24th and 25th, 2021, down at the Doubletree Inn in Nashville, Tennessee. So for more information on Checkin' First mini dental implant courses, visit our website at checkinfirst.com, and we look forward to seeing you on the next Monday Morning Minute.